Foodborne diseases have been an issue that societies have been grappling with since the beginning of humanity. The types, severity and impacts of these illnesses have changed through the ages and are still diverse across regions, countries and communities.
If a certain food has some toxins in it, or even germs which contaminate the food, if you boil the food which was contaminated by germs, but the germs had produced toxic products, they themselves can also cause food poisoning.
The germs, once ingested, cause diarrheal diseases which account for 70% of the foodborne disease burden globally.
Unfortunately for Ugandans, foodborne diseases or food poisoning is very, very common. First of all, we have a lot of germs here. So we have a lot of viruses, we have a lot of fungi, we have a lot of bacteria which can cause this. And unfortunately, food hygiene is not the best.
Dr. Vincent Karuhanga is a physician and health practitioner in Kampala. He says there are groups of people who are more at risk of catching infection from eating contaminated food.
Many times, especially people who are sick with HIV, the elderly people, those who are pregnant, and infants and children. These ones are much vulnerable and they can actually die.
Only a fraction of the people who become sick from food they have eaten seek medical care. The World Health Organization categorizes key foodborne diseases and hazards as follows: those caused by bacteria, those caused by viruses, parasites, chemicals and toxins. Through bacterial infection, one is likely to suffer from Listeria, which causes blood poisoning and meningitis. The bacteria is common in raw vegetables, ready-to-eat meals, and processed meats, to mention but a few. The others include brucella, commonly found in unpasteurized milk, and cholera. Viral infections include hepatitis A, a liver disease transmitted through contaminated food by the feces of an infected person. The parasitic infections include pork tapeworm, Chinese liver fluke, and toxoplasmosis, among others. These cause infections of the liver and diseases like epilepsy, cysts in the brain, tumors in the liver and lungs.
This can be due to dehydration, this can be due to the toxic substances one is taking, and this can come anytime if a person is not properly diagnosed and treated.
Treatment is done based on the infections that one has been diagnosed with. Dr. Karuhanga says the symptoms depend on the type of food poisoning one has.
The basic symptoms we always say are diarrhea, vomiting, and abdominal pain. One can get muscle cramps, one can get joint pains, headaches, and fever can also come, especially if it is due to germ infection. People who have had cyanide poisoning, they can get acute poisoning, but they can also get problems with this gland which is here, the thyroid gland. They can get problems with the pancreas. Some of them get what they call the Konzo syndrome, where people walk as if they have taken alcohol and even get paralyzed. People don't know that cassava can be a very dangerous food if it's not prepared properly or if a wrong type is taken.
There are other foods known to be toxic and can cause poisoning once consumed raw or poorly cooked.
For example, mushrooms, and this is why people should be careful about mushrooms they eat. When you find mushrooms in the shop, you should know that those ones can have a problem. Sorghum can be contaminated with a fungus, Aspergillus flavus, which causes aflatoxin poisoning. This one, together with granules, have been found to cause liver damage. But the good thing is that we don't have such food store for a long time which can get the fungus. But taking the fungus in small amounts, of course, can mean that eventually one's liver can get damaged by the toxic product of the fungi.
He says the best way to avoid getting infected is by washing hands, foods like vegetables, fruits, and properly cooking our meals.
If you cannot wash them, we say peel them, boil them, or you don't eat them.
Walter Mwesije, NTV.